Hi, all. Welcome. Thank you so much for joining us today. I'm Emily Baldy. I'm a senior manager at the School-Based Health Alliance. We are a national organization that supports the work of school-based health centers. We also serve as a national training and technical assistance partner through the Bureau of Primary Healthcare, which is the stream that's funding today's webinar. We are so appreciative that you are giving some of your time to be with us today to talk about how school-based health center providers can support their students in having healthier relationships. I'm going to do a little bit of housekeeping, and then I have the joy of introducing our fantastic presenters. All attendees are in listen-only mode, which means that you can hear us, but we won't be able to hear you. If you'd like to ask a question during the session, you can do that by using the Q&A icon that should appear on the bottom of your Zoom screen. If you'd like to turn on closed captioning, that should also be at the bottom of your Zoom screen, the CC button. We'll have a very brief evaluation poll at the end of the session, which we hope you'll complete because your feedback is helpful to us. Our hopes for today are that you'll be able to define the dynamics and potential impacts of teen economic abuse, and that you'll be able to identify some strategies that providers can use to support patients who are experiencing economic abuse. We're joined today by Jordan Battle and Anna Lopez Van Balen, both of whom are at partners with, excuse me, I was about to say partners on IPV and exploitation, but they are at Futures Without Violence. We have worked with their team through our BIPIC funded work to support providers in addressing adolescent relationship abuse. But I'm so happy that Jordan and Anna are with us today to talk a little bit more about their work, and perhaps more importantly, to talk about what it might mean for taking care of your patients. So I'm going to turn it to them to share a little bit about themselves and their work.
Great. Good afternoon for those of us on the East Coast. And good morning if you are joining in from the West Coast. I am so excited to be with you here today and to present on this important topic. And before we get started, I just wanted to introduce you to Futures Without Violence. For those who may not know us, for almost 40 years, we have been working to build thriving families and communities free from violence and filled with hope and opportunity. Next slide. As Emily mentioned, my name is Anna Lopez Van Balen, and I have the pleasure of leading the Economic Security and Opportunity team at Futures Without Violence. And our team specifically is committed to supporting women, families, and all people to pursue economic choice, dignified employment, free from violence. Co-presenting with me today is my colleague Jordan. I'll give her a moment to introduce herself.
Yeah, hi everyone. My name is Jordan. I am a program specialist here at Futures and really excited today to talk about some healthy relationship strategies that you can employ when talking to teens.
So now that we've introduced ourselves, I will say we love to have a dialogue when we present our information. So I would love to know who's in the room. If it's possible for you to put in the chat where you're tuning in from and maybe the role you play in your community, that would really help us as we share our talking points related to teen economic abuse, and to also just know who's in the room.
As you're typing in the chat, you may need to select everyone rather than hosts and panelists. So there should be a little to part at the top of your chat. So select everyone so that the whole group can see. Thanks.
Thank you, Emily. So we're going to wait to see if, as folks put their name and maybe title and community in which they are tuning in from, and that will help us. Wonderful. Juliana Campos, who, health educator from New York. Let's see who else has joined us today. Ellen Wilder, Respect Training Manager in Austin, Texas. We have folks from California and Seattle and Pennsylvania, Illinois, Iowa. This is great. Such a pleasure to see who's calling in. Department of Education and Workforce. Good to know. case managers, consultants. We have someone from Hawaii who's joining us. Welcome. From Walla Walla. Wonderful. It's such a pleasure to see where folks are tuning in from and to learn a little bit about the roles that you're playing, because though this is geared specifically towards school-based health centers, all of what we're talking about are things that you can address and employ within your school communities or more broadly in your larger communities. And we'd be happy to follow up with you to share more about how to do that. And so with that, let's go ahead and go to the next slide.
A little bit of sharing difficulty.
That's okay.
There we go. I'm going to stop and start again.
Okay. So as we mentioned, we run a number of different programs that address economic empowerment and opportunity at Futures. But today we're specifically going to be talking about our work related to teen economic abuse. And so our hope is that by the end of our conversation today, you'll be able to recognize some of the unhealthy relationships, behaviors that are identified with teen economic abuse, demonstrate how you can engage teens in conversations about healthy relationships, and apply an intervention called CUES that we'll talk about a little bit later that really focuses on providing healing-centered support to teens. Next slide. So with that, let's start off by defining what we're talking about. And so when we use the term unhealthy relationship behaviors and abuse, we are specifically talking about a pattern of methods and tactics used by a person or persons to gain and maintain power and control over a dating partner. The statistics out there state that 1 in 12 teens will experience physical dating violence and 1 in 10 will experience sexual dating violence. And it's for this reason that we are deeply concerned about this and how it impacts the future trajectory of young people. Especially since sometimes it's perceived that these are one-time behaviors, and instead we actually know that these are not one-time behaviors and actually can escalate and get worse. Partners can employ a variety of tactics that are meant to really employ power and control over their partners. And so we'll go to the next slide. You may have seen this before, but often these behaviors and tactics are described in the power and control wheel. We're using one called the teen power and control wheel that references some of these tactics. And you can see they range from peer pressure to isolation, as well as anger and emotional abuse. But today we're going to be focusing on economic abuse and the role that it plays in dating relationships. Next slide. And with that, I'm going to turn it over to Jordan to talk more about what this looks like amongst young people.
Yeah, thanks, Anna, and thank you again, everybody, for being here today. We'll go ahead and jump in. Teen economic abuse is a term where we refer to a form of dating violence that involves the use of financial control to create dependency and block pathways to his teen's safety and overall well-being. This type of abuse can disrupt critical areas of a teen's life, including their education, work, finances, and has far-reaching consequences such as damaged credit, a decline in school performance, or delayed career development. Teens are just starting to navigate financial independence, whether that be getting their first jobs, managing their own money, or making decisions that will ultimately shape their future. And so during this time, teens may not recognize what they're experiencing is a form of abuse, which is why it's so important to talk about it with them, help them be able to recognize the warning signs, and make sure that they have the support they need to build a healthy and independent future. So now let's take a closer look at how this form of abuse can impact different aspects of a teen's life. We can go to the next slide. So as school-based providers, you may see students struggling academically or dealing with stress, but you may not always know the underlying cause. Economic abuse can be a hidden factor that influences a student's school choices, finances, or employment. As it relates to school choices, a partner might pressure a teen to skip school, drop certain classes, or even choose a college based on what they want rather than what's best for the teen and their own decisions. Financial actions, this could include teens being forced to turn over their paychecks, letting a partner control access to their bank account, or making financial decisions that lead them into debt. Missing work, this can look like a partner trying to guilt trip a teen into skipping shifts, preventing a teen from accessing a car to be able to get to that shift, encouraging them to quit their job, or passing up other career building opportunities. Over time, these experiences can shape how teens navigate money, work, and relationships as they grow into adulthood. And to better understand these impacts, let's take a look at how prevalent economic abuse is among teens across the country. So, Futures Without Violence in 2021 worked with the University of Pittsburgh Medical Center, and we conducted a national online survey that went over to 3,000 teens. And we're hoping to better understand how economic abuse may be showing up in their lives. And we found that nearly 70% of the teens who responded in the survey reported behaviors associated with economic abuse, so that being interference with school, work, or finances within their dating relationships. This number was even higher at 86% for teens with a history of physical or sexual violence in their dating relationships. And 89% of teens had reported exerting economic abuse behaviors toward their dating partners. Also in this survey, we asked teens about how their views on healthy relationships and financial management were shaped. So we can go ahead to the next slide. Over half of the teens who responded to the survey identified that their views on healthy relationships and financial management were influenced by their parents or guardians, teachers, school counselors, or friends, which is where you all are going to come in. So now I'm going to pass it back to Anna to begin introducing some strategies that you can take when engaging conversations with teens about these topics.
So before we move on, it would be great to know, is this the first time you've heard the term teen economic abuse? If so, can you just say yes in the chat? And there's no judgment from us or anyone here if that is true. It would be helpful to us to know as we continue to talk about this in the future. Thank you. Seeing a lot of yeses come in. I will say that as we have talked about this in other settings, as well as with other youth-serving organizations, workforce development entities, what we often find is that people may not know the term, but have certainly seen the behaviors and often can finally put a name and a face to what they're looking at or what they're observing amongst teens. And so thank you for all of you who were willing to share. And yes, it's why we're here today, to hopefully help you better understand what this is and how you can respond. Okay, and so again, these slides were developed specifically for school-based health centers, and so I'm going to talk about that first. But we know that school-based health centers are safe spaces for young people, where they feel that they can go to and receive the help that they need. And research has supported that, often stating that adolescents who use the school health centers often have higher reporting rates of physical and sexual violence in their dating relationships than in the broader general public. And yet, only 1 in 3 adolescents are screened for adolescent relationship abuse. We are not here to advocate for screening. And in fact, we're going to talk about the CUES framework, which actually is a different approach to screening. But it's important to know the role that school-based health centers play in the context of adolescent relationships abuse. Next slide. And so with that, we identify 4 areas of intervention that you can take in your school community or in your community at large. And the first and most important one is recognizing the signs of unhealthy relationships and intervening early. And so this looks like looking for warning signs such as frequent absenteeism, diminished school performance, manipulation, financial distress, or even maybe recent purchases that seem out of the ordinary or not in the context to what this young person might have the means to have. But it could also might signal change in, these things might signal a change in circumstances, isolation, and offer the opportunity for you to quickly offer support. Secondly, our intervention approach, which we call CUES, and is accompanied by safety cards. We believe that this is a trauma-informed support for youth, connecting them to trusted professionals for guidance. And CUES stands for Confidential Universal Education and Support. And Jordan is going to go into what that looks like momentarily. But it's an intervention framework developed in conjunction with the University of Pittsburgh Medical Center that equips trusted adults to address all forms of domestic and dating violence in a non-judgmental, empowering way. Next, we want to encourage you to foster open dialogue about healthy relationships and financial literacy. As Jordan alluded to, this is a very important time for young people as they're just starting to understand what it looks like to have money, let alone know how to utilize it. And so there's opportunities to really help them learn about the importance of financial independence, but also what it looks like to have respectful relationships, and while understanding what are financial control tactics that they might experience from their dating partners, but also other adults in their lives. And this not only empowers the teens with the knowledge they need to make healthy decisions, but also ensures that they are better equipped to recognize signs of abuse and take steps towards safety. If you already provide financial literacy education, this is something easy that you can embed right into your curriculum to reinforce the economic principles you are teaching. But there might be other spaces within a school setting that might also make sense to embed this into existing educational resources. And the last thing that we want to talk about is just raising awareness more broadly. We have resources on our website that we can share later on what's the easiest ways to find them. Maybe we can even put links in the chat for that, Jordan. One of which is called an action guide that we developed that kind of summarizes everything we're talking about today as a resource to share with others who want to learn more about teen economic abuse. But we also have a tool called a Campus Action Toolkit, which offers practical resources to support anyone looking to launch an awareness campaign digitally or around your community. I'm going to pause here. I know we're going to pause here. We're going to have time at the end for questions, but I also want to invite questions for those who might already have them, and either you could put it in the chat and we will do our best to respond. Otherwise, we will save questions for the end. So with that, let's go to the next slide. Great. And so we've talked about CUES, which is the framework we're going to introduce, but it's accompanied by what we call safety cards. And at Futures, we have a variety of them since the work that we do encompasses different forms of intimate partner violence and specifically in this case with young people. And so we're highlighting 2 for you today. One is called a hanging out or hooking up safety card. And that one is easily found on our store, and it's something you can download or even purchase for your community. And then we also have the Teen Economic Abuse Safety Card, which is one we've developed specifically for this project and summarizes what it is, what's the prevalence, and what are the behaviors that you should be concerned about, but more specifically, the resources that young people can turn to get assistance. So with that, I'm going to turn it over to to Jordan to talk more about cues.
Awesome. Thanks, Anna. As was mentioned, CUES is an intervention framework that was developed by Futures Health Team along with the University of Pittsburgh Medical Center. And it's a framework strategy that encourages that all teens are receiving education on healthy relationships, regardless of if they're just demonstrating behaviors of being in an unhealthy relationship. So Q stands for confidentiality, universal education, and support. Confidentiality would entail protecting the privacy of every teen to help build trust within one another and between the teen and the systems. Universal education would include providing healthy relationship education to all students, and then support, offering continuous support and access to resources so all teens feel that they can make healthy choices and be able to seek help if needed. We'll go over to the next slide to see some examples of what this intervention may sound like when you're actually having a conversation with teens. So first, prioritize seeing the teen alone and disclose limits of confidentiality or mandatory reporting up front. You can say, we know students like to bring in their friends for support sometimes, and we're glad to come back to get them as soon as we've had a chance to check in privately. Or, what you share with me is private, but if I hear something that makes me worried about your safety or someone else's, I may have to share that with someone who can help. If a report is necessary, make sure you let the teen know what will happen next and engage them as much as possible throughout the process moving forward. In terms of universal education, start by normalizing the safety card activity. When they come in, hand them the card, and you can say, I've started giving 2 of these cards to all of my patients in case it's ever an issue for you, because relationships can change, and also for you to have information to help a friend or someone you know who is having a hard time. Followed by opening the card and doing a quick review out loud together. You can say, it talks about healthy and safe relationships, ones that aren't, and how they can affect your life, and situations where young people are made to do things they may not want to do, and some tips so you don't feel alone. And then lastly, make sure to highlight the support that's available on the card. You can say, on the back of the card, there are 24/7 text and hotlines that have folks who really understand complicated relationships. You can also talk to me about any health issues or questions you have, and you can use hypotheticals like, my friend has this problem, question, or concern, and that way you don't feel any pressure to share your personal information. By integrating this cues approach into your conversations with teens, you can create a supportive space where they can learn about healthy relationships and access resources without fear, pressure, or shame. So now let's take a look at some evidence that supports why using this strategy as an intervention framework is beneficial. So the School Health Center Healthy Adolescent Relationships Program tested universal education as a program model in 8 school-based health centers in California. And they found that students were more likely to recognize sexual coercion and relationship abuse. More students became aware of available relationship abuse resources. Teens with recent experiences of abuse were less likely to experience continued victimization after 3 months, and more students disclosed experiences of unhealthy relationships to their health providers. So by providing this type of education and these resources in a way that feels accessible and judgment-free, we can help teens better understand their experiences and take steps towards safety and support. We can go over to the next slide. And so after all of this information, just remember that adolescent relationship abuse is about power and control. And while some of the behaviors may not be reportable, you can help students be able to recognize these patterns and be able to access the support that is needed. So just remember that it can sound like, he tells me what to wear every day, they pressure me to miss school to spend time with them, they threaten to put embarrassing stuff on social media if I don't do what they want. or I have to ask for permission to use my own debit card. These are some things that could raise alarms that a teen may be experiencing financial control in their dating lives. And next slide. And so just to close up here, I wanted to just provide an overview of some helpful tips on engaging teens in these conversations if they do disclose having experiences of these types of abuse in their dating lives. Make sure that you validate them, say thank you for sharing that with me, and let them know that they are heard. Ask them, what is your biggest worry? This helps center the conversation on what is most important to them right now based on their immediate needs and concerns. Let them know that you are here to help and ask them, what can I help you with right now? Talk about safer planning strategies. What has worked for you in the past when things were hard? Ask about what support systems they have in place. Are there people you can talk to about your situation? Who else offers you this type of support? And most importantly, honor them as the survivor, as the expert. They get to decide ultimately what works best for them and what happens next. And it's our roles to be able to help support them in making those decisions for themselves. And so with that, I'm going to pass it back over to Anna.
And so thank you, Jordan, for providing an overview of cues. Any questions on the cues framework? Hopefully you can understand that this is almost like a 1-minute intervention as you talk about and normalize the context and information in a safety card, provide that to the young person, and make sure they understand what's on the card. Any questions on that? We can go ahead and go to the next slide. And so with that, we hoped that you learned more about what you can do to support the adolescents that come to your centers, your schools, or who are involved in some of the programs in your community. What we've done here, along with what we've shared in the chat, is provide some of the resources that we've been discussing today. And so to learn more about our project overall, if you go to Futures Without Violence, and specifically to our Teen Economic Abuse Project site, which Jordan has put in the chat, that offers you information about not just some of the resources we've highlighted, but also the study and how in some of the articles that have come out that have been groundbreaking in describing what teen economic abuse is. And so all of that information is on our website. The other thing that we have done is just to ensure that you have the information about some of the national hotlines that are listed in our safety cards. Love is Respect is a 24/7 hotline specifically for teens and young adults about healthy relationships and dating abuse. They are well suited to support the young people in your lives, and they're actually connected to the National Domestic Violence Hotline. And so, of course, the broader hotline, you can call them as well, and they support survivors with a number of resources around domestic violence, but also around safety planning and guidance. And so these are just 2 resources nationally, but what the hotline will also do is try to connect you to local resources in your community, knowing that more often than not, a survivor or a young person in this specific instance is going to need potentially to connect with providers in the local community as they take actions or not with their specific needs. And so, and lastly, and not listed here, but I just do want to continue to highlight that even if you're not seeing these issues with the young people you're facing today, there's still an opportunity to raise these issues with the young people in your community, because we know that teen economic abuse is real. We know it's happening. And the more we can do to name it, to name the behaviors that are associated with it. It provides the young peoples an opportunity to really start putting names to things that they may not fully understand today, and maybe ask questions to trusted adults in their community. And so, again, we lifted up two resources. One was the action guide that we've recently created that kind of summarizes everything into something really small that can be shared with others. And then the same with our campus action toolkit, which was actually co-created with young people that we worked with from both coasts to help us really think through what it looks like to raise this from a youth perspective in their community. And so with that, I think we can open it up for questions.
Thank you so much, Jordan and Anna. As questions come in, one thing that I might ask you to talk a little bit about is when I have heard your team talk about cues and the S for support, of course, there are supports for young people like parents, families, teachers, coaches, faith leaders. But I also know that in a lot of places, local domestic violence agencies can be supportive both for young people and adults, but also for clinicians, school staff. I wonder if you would talk a little bit about local DV agencies and the kinds of supports that they can offer both to patients and to providers.
Sure, and I'll just talk kind of broadly, knowing that every community is going to be slightly different in what that looks like. Certainly, we do encourage as much as possible to provide to connect people to providers that might also be specific to one community. Because then they can also offer additional supports based on the specific cultural or other needs of a specific survivor. But yes, many, I would say many victim service organizations are there to provide support to anyone in need. And so they're there if you have questions about what is available. They're there to really work with the, we'll call them a client, as they have needs, a variety of needs, from legal needs that may emerge. Think of an order of protection sometimes might be needed. And so they are there to support with that process and maybe even connect to other legal providers in the community. But it could also be physical needs themselves. Like, so if there is need for to get away or to provide shelter, they can best support you and connecting the young person and or their family to the specific undisclosed location that might be of support. They could also help support with mental health needs. And so certainly you may already know who some of those providers are in your community as you refer other young people based on their individual needs, or even within your school if there are resources. But sometimes it's also helpful to have someone outside of the school that the young person might feel comfortable and safe with, and maybe kind of feels like disassociated with their friends or potential partner who also might be attending the school. And so those are just at a high level some of the different areas that a victim service organization in your community can be supportive with, as it pertains to this issue and related issues around dating violence amongst young people. Jordan, was there anything else you would add to that?
Thanks, Anna. And if you don't know what the organization is in your community, I am on the East Coast, and here we have a state coalition against domestic violence. So if I were to Google New Jersey Coalition Against Domestic Violence, in my state, the agencies are by county. I could find a list and then get connected that way. I'm not sure how much variation there is nationally, but often those state coalitions can help you know where to go next.
Yes, that is also true. And there's a national kind of coalition of all the state coalitions called the National Network to End Domestic Violence. It might also be a good resource to find your state coalitions if that is of help.
Thank you both. I'm just double checking the Q&A to make sure that we are not missing anything. I have one more question while we wait for folks to share what's on their minds. Um, can you share a little bit about, in practice, how you have seen providers roll out cues with their adolescent patients? So, is it that at the first visit annually the patient gets cues? Are patients getting cues at every visit? What does implementation look like? I'm sure there's a range.
Yes, that is a great question, and I'm sure will depend on the role that um, staff have in participating with young people. And so, we often encourage that at every visit, this is information that's provided because, maybe they didn't need it last time, but maybe they need it this time, or maybe they have a friend who needs it this time. And so, because it's such a quick intervention and an opportunity to provide tangible resources, it doesn't hurt at every point of intervention to repeat what Jordan spoke to about the framework and how to introduce this to young people. And even if they're what they're coming in to talk about might be about something different. And that's also something important to talk about. They might present with a different symptom, but this is just a chance to say, hey, by the way, we offer these cards to everyone who comes in to see us. And it's just a resource because we know that not all relationships are healthy. And so this provides you some more information and where you can get help. And so I think that's a good way of thinking about it and offers just an opportunity um, both to school-based personnel who might be seeing someone privately, but also in others in the school community who might be playing similar roles like counselors or other mental health professionals that you might be collaborating with. This is an opportunity to also work together on those things, knowing that there is often, opportunities as we talk about raising awareness more broadly, working in collaboration with other school staff on these issues really helps to both ensure that everyone is aware of some of the early warning signs of this behavior of teen economic abuse so they can intervene early and also hopefully then to be more responsive to the young people as they see these behaviors before things potentially can escalate and get worse. And so those are just a couple of thoughts to think about as you are, hopefully thinking about introducing this topic into your school community. We certainly have worked with others, including youth serving organizations who have also taken this CUES framework and the resources that we're providing and trying to integrate it into their existing curriculum. We certainly don't advocate to create a whole new curriculum for teen economic abuse. That's not realistic, and certainly just if anything, we wanted to complement things and strategies, interventions, educational opportunities that you might already have. And so this is just another thing to add to support hopefully the great work that you're already doing. And so those are just a couple of things that come to mind.
Thanks, Anna. There's a great question in the chat. I love this question. Can you talk a little bit about what to do when a young person has identified these patterns but does not want to change or seek help?
That is a great question. And thank you, Dominique, for raising that. I think, based on the reporting standards that you might have, especially these are young people, I think the main question of concern here is there harm to self or to others, right? And so if those issues are present, then we know that you will have to proceed with talking to the young person about reporting. But if they themselves are not interested in seeking help, what the CUES framework does is to allow them to take the resources with them. What we've learned from implementing CUES in a variety of health settings over the past decade is that more often than not, when you do the intervention, it leads to disclosure, even when you're not looking for it, which is what's so beautiful about the framework. So it takes the pressure off of you needing to know that that's what's happening. And so ultimately, if there's things that you need to immediately report on, and that's something you need to talk to the young person about. But if it's behaviors that are starting to escalate and may not have reached a point of severe harm, these safety cards provide you the information to at least inform them of what's happening and to potentially just find out more information and resources and support in their current relationship. And it could be something to support them in as far as following up with them. If there's opportunities to do that, on a monthly basis, on a weekly basis, as you see them going down the hallway, however that might look like. Those are generally the strategies that we encourage people to do. In the future, we're working on providing additional interventions for for youth serving staff within their organizations that might help potentially disrupt maybe some strategies that might maybe further trauma for young people, because we know that once the trauma is there, anything we do that is not trauma informed or is maybe what we find a lot is that something happens. Maybe this is a better way of saying it. Something happens. It's identified as potentially teen economic abuse, and what the person who identifies it says, you need to go talk to X person. And so immediately they're being transferred to someone instead of providing a point of intervention of support. And so for some young people, that can be trauma. And because it's like, oh, I get passed around to the next person yet again. And so in the future, we hope to have additional resources that really get specific to that. But in the meantime, what we encourage you to do is to go ahead and to implement this framework, utilize the safety cards. Where there's reporting, report it. And if not, trust that those resources they have the resources and they can follow up as they feel comfortable. Hopefully that helps answer your question. A little long-winded, but hopefully that helps. You're welcome.
Thanks, Dominique. Any other questions about dynamics of teen economic abuse, implementation of interventions, strategies for talking with young people about this dynamic that might be outside of what we typically think of when we think of abuse?
As we wait for questions, one thing that just came to mind is, we do have, as we've continued to study the results of the survey, and, we know that some populations are going to be more vulnerable to teen economic abuse than others. And so, as you might suspect, youth who already are involved, be it with the foster care system, are going to have a higher likelihood of being vulnerable to teen economic abuse. The same goes with any youth who've been involved with the justice system. And so, as you can imagine, anything that puts young people already with, where they identify with additional vulnerabilities is going to really put them in a place that might make them susceptible to, to experiencing, manipulation and control that others may even specifically target. And so those might be some things to think about as you're working with unique populations within your school community.
Thanks, Anna. I think I'm going to go ahead. You're welcome to keep dropping questions in the chat if you have them. I'm going to go ahead and launch our evaluation poll. We will share, oh, thanks, Andrea. We will share these slides and resources. Anna and Jordan, anything else that feels really important for you all to get to or share?
I think one final thing I would note is our work to date has focused on teen economic abuse in the context of teens dating relationships. But we do know that economic abuse and financial control can be done from other perpetrators. So it could be between a teen and their parent or guardian, a teen and their sibling, a teen and a friend, a coworker. So there's definitely also more areas to explore in terms of how economic abuse is showing up in teens' lives. So yeah, I just wanted to acknowledge that it doesn't just exist in dating relationships. It's just our research has been focused on that for now.
Thanks, Jordan.
Yeah.
We'll ask you to complete our Zoom poll. Again, your feedback is helpful to us as we think about planning for next year, etc. We will share the slides and recording and follow up. If you are interested in staying connected with our team at the School-Based Health Alliance, we have a bi-weekly digest where we share learning opportunities among some other things. We're also on social media. You can connect with us that way. I am so appreciative, Jordan and Anna, of your time and expertise today. I'm hopeful that people will have the opportunity to check out the resources you dropped in the chat and take a look at some additional information about cues. So I am going to say thank you so much to all for joining. You're welcome to reach out with questions. We hope to see you very soon. Thanks all.